it's Mel from Ultimate OSCE, and I'm here today to talk you through the APIE stations in your NMC OSCE exam, so you get a better feel of what you're going to be experiencing on your exam day. Okay, so the first station, and it's always the first station in your APIE section of your NMC OSCE, is the assessment station. So this is exactly what the station will look like on your exam day. You'll be assessed on safety. That's the first skill they're going to assess you on. So doing the three-way ID check on your OSCE patient, making sure that their allergy status is confirmed, making sure the environment is safe. They're going to test you on your clinical knowledge. So that means completing a set of observations, recording a set of observations, scoring a set of observations correctly, and also, of course, your communication. So this is the only station in the whole NMC OSCE where you have a live actor as your OSCE patient. So this will help you because you're going to build a rapport with the patient. You're going to pool and gather data from the patient about their concerns or any problems they have with the activities of living. And you're also going to show the 6 C's to the examiner. Okay? So the only thing you can take with you from this station to the planning station is this. This is a bit page with the activities of daily living. You put down any concerns you have that you meet with your patient, any problems you've identified, and you move over and take it with you to the planning station, which is the next station. This is the planning station. Okay, so there's no patient in this station, it is no live actor present, it is just a desk with a blank care plan on and a scenario that you're given. It's a 15-minute station, and the scenario you must read carefully. This will direct you how long you are going to plan nursing care for. So the clinical scenario for this station will advise you to write a care plan for the next 12 hours, the next 24 hours, the next 2 weeks, whatever it says, that's what you will do, okay? And the clinical skills that are being, or competencies that are going to be assessed in this station are obviously your clinical knowledge and identifying and prioritising individualised nursing problems for the patient, your organisation skills, and your written communication skills. Because you're going to be instructing in your document how the next nurse is going to look after your OSCE patient. Okay? After the 15 minutes is over in the planning station, you then move to the implementation station. Right, this is the implementation station, and this again is exactly what it looks like. So your OSCE actor is now a mannequin, and you are going to demonstrate clinical competencies in, first of all, safety, so obviously hand gel for infection control. You do with every station that has an actor or a dummy in playing the role of your patient. You are going to do a three-way ID check the allergy status. You are going to have a scenario given to you that will tell you to give the medications for your patient at a set time. You will give the due medications that are safe to give your OSCE patient. Okay, so your clinical knowledge is being assessed on you correctly identifying the medications that are safe for your patient. You are going to be also assessed on your record keeping skills. So you're going to be assessed on how you record your medications, how you code the medications you withhold, and also safety issues such as if you are going to identify any medications that are not safe for your patient, what steps you will take to make sure your patient remains safe. And also for communication, you will be expected to get informed consent for your patient and to demonstrate that you can explain to the patient what medications they're taking, why they're taking them, and what medications are not being given. Okay, so that 15-minute station is over. We're then going to move over to evaluation. So this is the evaluation station, and this is the last station in the APIE section of your NMC OSCE. Whew, you made it. So this is a 15-minute station, and you are going to be given a scenario which will ask you to write a transfer of care letter for your OSCE patient. So you're going to be detailing all the care that you've given, and you can use the written information from the earlier stations that will all come back to you. So you are going to write about all the care you've given, and you are going to advise future nurses on how to best look after your OSCE patients. That is the purpose as well of your transfer of care letter, and you'll be examined on that. Again, once you've done that, you've done it. That's the end of the APIE section of your OSCE. Hope you found this information useful. If you would like any more information about the NMC OSCE or help with IELTS, OET, CBT, please get in touch with me on Ultimate OSCE on Facebook or WhatsApp me. I've got the latest information on UK nursing jobs and support with your OSCE. Okay, bye.